My name is Mark LaRanger, pronouns he, him, President and CEO of Chrysalis. And it's great to be with you all today for another in our series of community broadcasts. We started these way back when COVID was just a baby little thing. And we've now been doing them for a couple of years to connect with folks in our community to talk a bit about our work. And we're really fortunate today to have a really distinguished and knowledgeable group to help us understand some of the latest data that we're seeing related to homeless count. So we'll get to that in just a second. But briefly, I just wanted to give you a couple of updates on what's going on with us at Chrysalis. Early this year, we began really reopening our offices full force ahead, despite COVID challenges and healthcare challenges and all the rest of it. And we're making really good progress with the implementation of a hybrid in-person and remote program, kind of taking the best of what we learned during COVID and also reintroducing much of our in-person programming. So far this year, we have had 724 community members find employment, and I am really delighted to say that 2/3 of those jobs are permanent full-time positions, which is the highest ratios that we've had in many years. And I'm also super excited that the average wage that our participants are getting with these outside jobs is $18.36. So I'd love for Chrysalis to take all credit for that in terms of building skills with our clients, but I think it also says something about the employment environment that we all have. And we're really optimistic that the folks that we're working with today are going to be able to go on to achieve their career goals and eventually get to that point where they can thrive in this very expensive area that we live in. The last time we were together, we talked about our roads program, our partnership with the California Department of Transportation. That was our focus. It's one of our social enterprises. And I just want to give you a brief update on that. We have now launched all of the new crews that we talked about on that broadcast. So we now have 24 crews operating throughout LA, Orange County, and now Riverside and San Bernardino counties. That means that we have over 150 of our clients that are working in those jobs every single day. We're really proud about that partnership with Caltrans. Many of those folks will transition to jobs with Caltrans or in similar really well-paying positions. So we're excited to see the impact of that program over time. But that is not what we're here to talk about today. I happen to be in our Orange County office, and it is great that we've got a number of Orange County leaders with us today to talk about some of the latest homeless count information. So I'm going to welcome my colleague Michael Graf-Weisner with us. He'll be facilitating our discussion and be joined with Erin, Matt, and Zulima, who will have a chance to introduce themselves. Just a reminder to our audience, there will be time for Q&A at the end of this, so please, if anything comes to mind, put it in the chat and we will do our best to get that question answered towards the end. Michael, I'll turn it over to you.
Excellent. Thank you, Mark. Thank you, Tiffany. And thank you to our panelists and also everyone attending today. Thanks for joining us. I wanted to start by just introducing or letting our three panelists introduce themselves. As Mark said, we are lucky to have some of the leaders addressing issues of homelessness in Orange County and partners of ours since we came to Orange County from day one. And so if all of you can please just introduce yourself, your pronouns, and which organization you are with, and I'll have Zulima start, please.
Hi, good afternoon, and thank you so much for having me. My name is Zulima Lundy, and I am the Continuum of Care Manager in the Office of Care Coordination within the County of Orange.
Thanks, Zulima. Erin.
Hello, Erin DeRyke, she, her. I am with 211 Orange County, and I'm the Director of CoC Data and Operations.
And Matt.
Thank you. Matt Bates, Executive Vice President of CityNet. Pronouns are he, him. We're a homeless services agency, and we were contracted by the County of Orange to conduct the unsheltered count for the point-in-time count. So that's why I'm here today.
Excellent. And I realized I didn't quite fully introduce myself. I'm Michael Graf-Weisner, he, him, his, and my role here at Chrysalis is Vice President of Strategy and External Relations. So we wanted just to dive right into the conversation today around the point-in-time homeless count for Orange County. And just to give a little context and to start us off, Zulima, I thought we could start with you. And prior to this year's point in time count, which the results just came out last month, the most recent count in Orange County happened in 2019. So a few years ago, and there's reasons for that I'm sure people can guess, but maybe you can give us a little bit about kind of what goes into these counts, how and when do they happen and when do they occur, the point in time homeless counts?
Yeah, of course. So the point in time count is a federal mandate by the U.S. Department of Housing and Urban Development and is broken into two main activities. One is the sheltered count, and that is conducted on an annual basis. And Erin DeRyke is our expert who helps us coordinate that for Orange County. And the second portion is the unsheltered count, and that has to be conducted at least every 2 years or biannually. So in Orange County, we have traditionally conducted those in the odd years. And we were all set to conduct one in 2021, but due to COVID-19, the federal government provided exceptions for communities to forego conducting one to ensure that we're not inadvertently spreading COVID or creating unnecessary exposure. So in 2022, we were planning on conducting the point in time count in January, because that's traditionally when it's had during the last 10 days. But around that time, we also had a big Omicron surge of the COVID variant. So we ended up pushing it to February of 2022. And we are excited for an opportunity to share the results of the point in time count. It provides us a baseline of where homelessness is in Orange County and helps us for our next planning discussions.
Thank you, Zulima. And you mentioned the kind of two parts of this, and we do have both Matt and Erin. Erin, I was hoping I could maybe turn to you next and talk a little bit more to us about that difference. It seems obvious in a way, the difference between kind of the sheltered and the unsheltered count, but tell us a little more about that distinction.
Sure. So the sheltered count is a count of clients that are being served in emergency sheltered, transitional housing, or safe havens on the night of the pit count in Orange County, while the unsheltered count is counting clients that are literally on the streets, so sleeping in parks, cars, tents, other locations that aren't meant for sleeping.
Thank you for that. And you mentioned the unsheltered count, which make me turn more to Matt now in CityNet's role. But tell us a little bit, maybe Matt, about the kind of how different entities kind of participate and why we have kind of the three of you on the call this afternoon. But tell us a little bit more about, in general, kind of the roles of who participates in the count, and then maybe also CityNet's specific role in the unsheltered count.
Yeah, so just to add into the complexity of sheltered versus unsheltered, I remember when I was first learning about this, I was confused because I was looking at Orange County and I saw one report in the Orange County Register that said that there were 30,000 homeless people in Orange County, and another article said that there was, I don't know, 3,000 or 4,000. And it was because there's two definitions of homelessness used by two different federal agencies. So as Zulima mentioned, this is a HUD project, Housing and Urban Development, but the U.S. Department of Education uses a much different definition of homelessness, which is much broader. So I think that inherent, there's some confusion because you've got two federal departments using two different definitions. There's good reasons that they do that. The Department of Education is trying to be more expansive because they're trying to allow resources to flow to families that might need it. But just an example of people who might be thinking about this from more of an outsider's perspective, if somebody is, let's say that on the night of the point in time count, they don't have a home at all, but they were able to pull enough money together for to stay in a motel room for the night. If they were able to do that, then they're not considered, according to the HUD definition, as homeless, because they were able to pay for shelter for the night. Now, the Department of Education would consider them homeless. Like, that's just one example. So we're following very specific definitions, and it gets pretty technical. But to circle back to your question, CityNet's role is to mobilize volunteers and coordinate with city and county agencies and mobilize agencies within the continuum of care to try and go out in the last 10 days of January, to survey as many homeless neighbors as we can. So we're engaging on what's called the survey-based count, where literally we tried to interview anybody that is homeless all across the county. And so that's the unsheltered component of it. And then that's matched with the work that Erin and her team are doing with the shelter providers to provide a sheltered count. And then at the end, you put it all together and you've got an unsheltered count, a sheltered count, which equals your homeless count, again, according to the HUD definition.
Yeah, and then of course, in addition, I find that sometimes there's confusion on, and we've a couple times even used the acronym PIT. So we'll try to not use too many short acronyms, but essentially that's the point in time count, which I know there also have been estimates of, what is the count of homelessness, because it is cyclical over time, and how many people collectively or cumulatively experience homelessness in a year, for example, because that number is much higher too. But yeah, thanks for bringing in that subtlety, Matt. Zulima, do you have anything to add? Because I know where you sit at the county is an important role in this puzzle, and maybe you can tell a little bit about how your team at the county and yourself help lead this effort.
Of course. So the County of Orange serves as a collaborative applicant for the Orange County Continuum of Care, and that's a very technical and specific role. And I only bring it up because the function of conducting a point-in-time count is really charged to the Continuum of Care, which is really a local planning body aimed at addressing homelessness. And part of that effort, right, is around ensuring that we're doing a point-in-time count that brings value to our community. So in 2019, we changed our methodology. So as we went into the point-in-time count for 2022, we were really excited to conduct a point-in-time count that replicated that same methodology so that we would be able to compare the results year over year. Well, not exactly year over year, but point-in-time count over point-in-time count to ensure that we're measuring progress or that we're evaluating people experiencing homelessness. So my team specifically was charged with kind of coordinating the efforts that Erin and Matt and his teams were leading to ensure that it was complementary, and then also providing that community and stakeholder engagement piece, including cities, departments within the county structures and others in order to be able to recruit volunteers and support, because there's plenty of activities leading up to that point in time count that require the knowledge and expertise of many folks to make it a success.
Thank you. So I feel like we've been kind of giving some context and talking about the count, but now let's talk about the actual count results. So I think, Tiffany, you had maybe a slide that you could pull up with those numbers, or some of the numbers, and there's a lot of them. But on the high level, I know there's been media about this and a lot of conversations about, as it should be, about this kind of difference. What are we seeing compared to the last count and this count? So number of stats on your screen, and this is all provided from the county, but that top level number, to Matt's point, we're kind of combining the sheltered and the unsheltered, that was found for 2022 was 5,718, which did represent close to a 17% reduction from the 2019 count total. But kind of stepping back, and Zulima, maybe we can again start with you here. Just starting high level, what are your kind of takeaways, and what struck you about this data as it was released, and as someone who's working in this sector, what struck you about the data?
Well, I think the most striking piece is to know that it was approximately a 17% reduction in the number of people who were counted, including the sheltered and the unsheltered. And really that piece of information is leading to so many more questions in terms of understanding the changes in the homeless population and how they're experiencing homelessness, and also how they are engaging in services. Because we're really looking at this data to kind of ask the next set of questions that will assist us in continuing to create programs and fund resources that best address homelessness, but also looking at what type of programs have we been operating that have maybe been successful and attributing it to people being housed and no longer having to access shelter or no longer experiencing homelessness on the streets. So from that sense, we are encouraged, but we realize that there's a lot more work a long way to go, because we would like that number to be smaller and smaller over time, in order to really measure our success and really to also note that it's important to keep an eye on this, but not bank it as a be all one all, just because it's a point in time count. So we understand, like you mentioned, that homelessness is cyclical and may not be reflective of everyone's experience.
Thanks, Zulima. And Matt, I think I may turn to you next as both an entity that kind of led the actual count itself and also is providing services ongoing. Would love to get some of your thoughts on, when these results were released and what you take from them.
Yeah, well, the first thing, I know that Erin and I and our teams, our primary goal in this project is just to be as accurate and thorough as we can with the data. So just want to say that, the first goal, really the main goal, is just to set the reality. Here's what is. And then now what we're talking about is kind of interpreting what does that mean. But I do want to note that, we worked very hard to keep everything as similar as we possibly could from 2019 from a methodological standpoint, so that we could trust the numbers, ultimately what they were, whatever they were, that we could trust that they were as accurate as they possibly could be. So just want to state that. But I think, yeah, from an interpretation standpoint, I agree with the Zulima. I think it shows that, from my perspective as a service provider, it shows that interventions matter and that this is a cause that responds to resources and interventions. And countywide, there have been, there's been a lot that's happened between 2019 and 2022 in terms of homeless interventions. Everything from emergency shelters to street outreach and engagement to prevention and diversion, all the way to permanent supportive housing developments. Just investments all across the board in all three service planning areas, investments made by the county itself, by cities, and by private entities that have stepped forward with interventions. So there's been a lot that's happened. Obviously, on the other side, we know that there's been, ongoing rising housing costs and kind of wage stagnation. We know that that COVID threw a big curveball into everybody's life in terms of, the economic impacts of COVID, and some of those are even maybe yet to be felt. So on the other side, you got people falling into homelessness. But I think overall what it shows is that the county is on the right track. The continuum of care across the county, we're on the right track, but there's more work to be done.
Thanks, Matt. And Erin, you as well, I think on the sheltered count, I know that you had wanted to share some information here that Tiffany's added to the screen, but tell me a little bit about what you saw in the sheltered count and maybe what's behind those numbers.
Sure. So at the same time as the point in time count, we also conduct the housing inventory count, or HIC. So that is a count of all of the beds in Orange County that are dedicated to serve homeless clients. And so this chart is showing the last 4 years of bed inventory for Orange County. And the bottom two colors that you're seeing, the purple and yellow, represent emergency shelter and transitional housing projects. So you can see over time that the bed inventory for those project types is mostly staying the same. The difference between 2019 and 2022 is only about 100 less beds. But the top three bars in each column are permanent housing projects. So the blue is rapid rehousing, the orange is permanent supportive housing, and the green is other permanent housing. And we've had a large increase in that bed inventory, particularly in the past year. And between 2019 and 2022, we had over 2,300 beds added to our bed inventory. So that increase is definitely allowing clients to move from both sheltered and unsheltered situations to these beds and impacting the pit in that way.
Thank you for that as well. Matt, I wanted to kind of turn back to you on this, because I think what goes into doing a count like this is a huge undertaking, in particular the work that you did on the unsheltered count. And I was curious if you could tell us a little bit about the kind of investments in technology that perhaps are helping you and all the volunteers and staff that do this work, that allowing CityNet to do these surveys and actually, like you said, get data that we can rely on that shows how we're doing. Can you talk a little bit about the technology side of this?
Sure. And as Zulima mentioned, this was a repeat of what the county did in 2019. So at that point, there was a big change in methodology where the county went to a survey-based count and used it using a phone app called Survey 123, which is produced by a company called Esri out in Redlands, and most of the cities in California are contracted with Esri because they're a leader in sort of geospatial technology used by planning departments all across the state. And so what it allows for the data to be collected in real time and analyzed even kind of more or less in real time. So if the volunteers who went out on the count, either on 2022 or 2019, can recall, at both times there was a board in the deployment center, and it would have dots of all kind of populating of all the surveys that were taking place. Well, not only was the dots of the location of where the homeless person was, but also all of the survey question answers were uploading into a database that the county could analyze. And so what it allows for, one is it allows for kind of this immediate data that it's raw data. It still needs to be gone through and deduplicated and that kind of thing. But you don't need to tabulate like thousands of interviews and dozens of questions for each interview. And when you have to do that by hand, your error rate shoots way up, and it just takes much longer. But the other thing you can do is that even during the days of the count, if on day one you can look at the date, you can look at the results, and if a section were skipped, or if a portion of the county the numbers didn't look right, you can send teams out and you can reassess. And so it gives us that kind of real-time ability to manage the project, to know where to deploy volunteers most efficiently, so that so that when we're sending teams out, we can make sure that that they're not going to be overwhelmed by having too many people to survey, and also that the volunteers that we're using, they're going to be efficiently, that their time is going to be full, recognizing that even though it sounds like a lot of time, 10 days, for a county as large as Orange County, with as many people as Orange County, many geographic miles to cover, it's a sprint to get it all done. So so that the technology component that has really facilitated this approach, and it's worked really well. We have very few technical glitches. You always worry about that, technical concerns, but very, very seldom do we have any kind of those problems. And then also the feedback from the volunteers is consistently very positive with that.
That's excellent. Shifting now from kind of the technology and the overall count, the data also gives us a lot of information about demographics and the needs of the population of individuals and families experiencing homelessness. And we didn't have time in today's session to get deep into that information, but Zulima, I'd love to hear from you, maybe to start a little bit about what you saw in terms of the demographics, the needs, and maybe even looking forward, what it means next for us.
Yeah, thank you so much. So when looking at the data, we already mentioned the overall decrease in people experiencing homelessness, and we saw that trend even as we looked at specific age groups, races, ethnicities, and breaking down the data by subpopulations such as those veterans or transitional age youth, which are folks between the ages of 18 to 24. However, the one area that didn't see that downward trend was really seniors. So that leads us to believe that we have an aging homeless population. And then also correlating with that very similarly is we also have an increase in some of the reported disabling conditions. So the point in time count, in addition to, counting every person that's experiencing homelessness, also has questions about, self-reported disabling conditions or things like substance abuse, physical disability, and mental health issues. And we saw an increase for adults between 2019 and 2022. So what we believe to be seeing is that not only are folks getting older on the street or in shelters, but they're also having higher needs, which means that our services have to be able to adapt and be able to help folks navigate to the appropriate services that may be able to address some of the reported needs or disabling conditions that they had. So I think that's an area that the Office of Care Coordination is going to focus on in terms of how can we best tailor our approach to be able to look at people and address not only their housing needs, but also their disabling conditions to support with their other goals. I think the other part that I would note, sorry, Michael, would be that we also look at household composition. So we also saw a decrease in families experiencing homelessness. And then one point that was interesting was that the number of children experiencing homelessness also decreased significantly from 2019. So maybe we're also seeing a shift in household size for families.
Thanks, Zulima. Yeah, I think there's a lot of good data for us to learn from, and I think we will put, I know we flashed some of it on the screen, we'll put a link in the chat for those of you on the call for the county's report, which shares a lot of these details. I did, in our closing minutes, I do want to go and make sure we get to at least one or two of our questions that have been submitted. Thank you to our attendees who've been submitting. But we had a question around prevention. Obviously, we're looking here at numbers of individuals experiencing homelessness. And one of our folks on the call today wanted to learn about what's happening, or at least a quick version of what's happening around prevention efforts in the county. And whoever wants to take this first, either Zulima, I know we all are involved in ways, but if you want to start, Zulima, go ahead.
Sure. I would just say that, the reasons why people become homeless or experience homelessness are so varied and diverse. So while there are some services in place to be able to address their needs or assist them in remaining housed, is not one solution that fits all. So with that, I know that the County of Orange has a big emphasis on, connecting people to mainstream benefits and supporting some of that. But we've also saw a huge benefit in operating homelessness prevention programs that offer emergency rental assistance and assist with rental arrears, especially during COVID. And now that the state is operating the California COVID-19 rent relief program, we've also saw a huge need for those. So I think at least in the last 2 years with the COVID-19 pandemic, the demonstrated need for financial assistance and people and how that leads to housing instability is something that we continue to evaluate, and we'll be looking at ways to focus assistance in those areas to promote housing stability as opposed to falling into homelessness.
And then I would just add, if I could, I want to affirm the subtext of the question, which is that we would agree that prevention is critical, and it's better for everyone if we can prevent homelessness rather than having to address it after it's occurred. And that's like so many other things. It's like going to the dentist, right? It's so much less painful and less expensive if you can prevent the problems than rather than having to address them when they're full blown. So I want to affirm the kind of the basis of the question. And the other thing that I always like to point out with this question is it's also it's a place where those that are maybe not like us, who are kind of involved in homeless services day to day, but what we see is like faith communities, for example, ethnic communities, across the county, maybe immigrant communities that will support one another and prevent homelessness by reaching out and supporting those that are facing economic loss, or maybe job loss, or maybe domestic violence, or some kind of a catastrophic life event that would, that if you don't have a safety net, kind of put you out on the streets. And so this is where we see, the general public really playing a strong role by, in the areas where they have a stronger sort of civic fabric and civic identity, and people are looking out for each other, they can help prevent this from happening. And that is something that's difficult to measure, but we intuitively know that that is probably the most successful and the largest prevention and diversion category, anything that was than what is done compared to what is done, formally by the homeless services system or the continuum of care. So that's just to say, we just want to, I think as a continuum of care, we need to look for ways that we can continue to partner with those agencies, those faith communities, those others that are engaged in that work, because it's so important.
I feel like this discussion has just barely scratched the surface, right? The data itself is very rich and tells story after story after story as we dig into it, whether it's various demographic groups or trends that we're seeing. But unfortunately, we don't have more time today because we committed to half an hour. Chrysalis, we like to start on time and try to end on time as close as we can. So Erin and Matt and Zulima and Michael, thank you so much for joining us and sharing about this really important topic. And we'll look forward to seeing all of our guests the next time on our community broadcast. Thanks, everybody. Have a great solstice.